Welcome back. The coronavirus pandemic. States across America ordering residents to stay home. This as more than 46,000 COVID-19 cases are confirmed across the country. Nearly 600 people have died in the United States. Joining me right now, the White House Coronavirus Response Coordinator, Ambassador Dr. Deborah Birx. Dr. Birx, thanks very much for joining me this morning. We have really enjoyed your commentary on that task force, and I was watching you yesterday, and I was really struck by so many of the things you were saying, in particular that you were appealing to Americans to help in this fight. You said, look, I haven't seen my grandkids in a couple of weeks, my daughters as well, and you know it's hard. How are we doing? The American people have listened to your guidance, listened to the president's guidelines. How's America doing, and how would you say the plan is working so far? Do you have any data to show if this is working?
Well, we hear from you, and we hear from communities around the United States and from mayors and governors where it is working and where it is working well. I just want to really applaud all the American people who have taken this seriously and understand that although you may not be at the greatest risk, you're protecting others who may be, and that's why we have to be in this in solidarity. It's been exciting to me to really watch mayors and governors and the president working together to really ensure that America's health is protected.
When are you expecting this to peak out, Dr. Birx? I mean, in terms of when you feel that the virus is less of a worry, what are you looking at going out in the next couple of months?
So this would be like me asking you what's going to happen in the stock market and when is it going to peak and when is it going to go over 30,000 again. So these are questions that we're looking at trends and data. Like you look at trends and data, it's the same. We approach it in the same way that many economic groups approach their data. The better your data, the more granular the data, the more specific the data, the more direct you can really predict. We're looking at the Italy data. I think we're encouraged over the last few days to watch the number of deaths starting to decline. That will be our first indicator that what we put in place and what they put in place in Italy 3 weeks ago is starting to have, or 2 weeks ago, is starting to have an impact now. Because deaths are a measure of what you did 2 and 3 weeks ago, not what you did now. So that's been really important to us.
Vice President Mike Pence said that people with no symptoms will be able to go back to work if they wear masks. When can employees expect to get to their jobs again?
So we wanted to make sure that first-line responders and our healthcare individuals that have had small exposure, our critical infrastructure workers, are able to go back to work and wear a mask for the 14 days. And then if they develop any symptoms, to self-quarantine. This is really to ensure that the critical elements of America keep going. At the same time, we expect the rest of America to really follow the presidential guidelines.
And tell us what you have learned so far in places like Italy. What are you seeing in China? I mean, you know, the Chinese are saying that there are no new cases, but it's hard to know if that's true. I mean, should we believe that?
Well, certainly we're relying very much on South Korea and Europe. You know, I think many of you know I've worked around the globe, worked with epidemics and pandemics around the globe, and the solidarity among ministers of health to share data is really quite extraordinary. Even in the midst of their very difficult time, Spain, Italy, France, and South Korea continue to give us information because we're about 2 or 3 weeks behind them, and we want to really learn what their best practices were and get them in place in the United States as quickly as possible. The world has never confronted a new virus like this in this depth of spread like this since about the 1918, 1919 time frame. And so we're all learning in the 21st century how to approach this epidemic in new ways and really understand how to be more effective, to really laser focus our interventions in new ways.
It's really extraordinary. And another thing you talked about yesterday, which was very important, was how long the virus stays on surfaces. Tell us about that and what we need to understand about things like cardboard and metal and getting our mail and money if the virus is on any of those things, bringing it into your house.
Yeah, so the data is on RNA virus. It's on the RNA component. So we're really trying to figure out, is that viable virus? How much is it viable? How infectious is it? And that's still an outstanding question. But we can measure RNA on surfaces and the degradation of RNA. And what do I mean by that? Whether the RNA is actually present in full length or is in pieces. So in cardboard and paper, the degradation times are much higher. It is the metal surfaces that we're most concerned about. And think about where you touch during the day. Hard plastic and metal, doorknobs, holding on to the handrails and subways. And so that's why we're very concerned in metro areas that have subways and other elements like that, or when you have to touch a keypad. These are things that we have to know where our hands are at all times and make sure that we're washing them if we have touched any of those surfaces or using hand sanitizer.
Because it stays for a couple of hours or days on metal?
So this is the really critical question. There are fragments of RNA that stay possibly for days. I don't know at this point how long the infectious virus is there. But I think if we still find RNA at 3 days, we should assume that at least up to 24 hours, there could be infectious virus there. So this is, I know it sounds like an abundance of caution, but we really need, this is why we've asked every American to follow the guidelines and critically know where your hands are at all times.
Dr. Deborah Birx, great to have you this morning. Please come back soon, and thanks for your leadership on this important issue for the country. Thank you so much, Dr. Deborah Birx.